As concerns about youth mental health continue to rise, recent insights from a Northumbria University psychology doctor shed light on the pricing trends in Newcastle and the wider northeast of England. This doctor highlights key patterns emerging in the mental well-being of young people, with some unique challenges facing in Newcastle.
Youth mental health, I think it's unsurprising to most people, there's been a higher report of young people generally, whether that be students or just young people out of work or employment, who are presenting with mental health issues at a secondary care level, so going to hospitals, going to emergency departments, etc., for help, but also seeking support from general practitioners, but also from a like the third sector, so voluntary groups, etc. I think generally referrals across the country are on the increase. There was a plateau during COVID, surprisingly. So whilst people were experiencing mental health issues, a lot of people were feeling that their mental health issues weren't warranted enough to seek support. And so there was a lot of people who were simply not accessing support. So there is research arguments both ways about whether it's a case of it's like, are we seeing more referrals as a repercussion of the pandemic, or is it a case of people that didn't get support, their symptoms escalated? I think in Newcastle particular, Newcastle is a very unique demographic. Like Newcastle as a city is often a city for a number of satellite towns and villages, where there's been a lot of historic cases of poverty and social deprivation. And I think cuts under previous governments have led to a lot of support that was available is no longer available. And so I think that's where a lot of problems in the Northeast manifest. And I think the flip side of this, and it's both a positive and a negative, is that mental health stigma positively is declining. People are feeling a lot more open about talking about their mental health issues. But on the downside of that is that whilst people can feel more comfortable self-referring to services, those services need to be in place to support that. Otherwise, people can end up feeling more stigmatized if they're being open about it, but not able to get support.